When last did you bedwet? Kedu mgbe ikpeazụ inyuru onwe gị mamịrị n'abalị? This is Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, treatathon.
Is Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, treatathon, the Lupus Day. I am here to talk about bedwetting. Urinating on yourself while asleep. Enuresis, natural enuresis. I want to remove that natural because it can also still happen during your siesta. So let's just call it enuresis. Bedwetting. Bedwetting is fatal, especially when it happens to adults. It can lead to psychological trauma. It can lead to low self-esteem. It can lead to psychotic breakdown. It can lead to being bullied. So it is bad.
Okay, so enuresis in adults can be divided into, it can either be secondary enuresis. That means the person was initially having enuresis before the age of 6 and now stopped. Then suddenly it started again. Or it can be from functional enuresis. In that case, there is the person having repeated involuntary passage of voiding of urine in an age that is adult age, where the person should have been able to have continence when and in the presence of no obvious physical deformity. So what are the causes? In order to break it down to the layman's understanding, let me start from head to toe. From the head is the brain, and the brain produces hormones. So there's this particular hormone called antidiuretic hormone, and this antidiuretic hormone is responsible for reabsorption of water. That means every water that your body produces, this hormone fights to prevent it from being urinated. That is what the hormone does. So the hormone reduces your urine. So now, if there is any damage to the brain that results in reduced production of that antidiuretic hormone ADH, that means you now be producing excessive urine, which can lead to urinating. The next one is anxiety. The next one is seizure disorders, epilepsy. Next one is stress, overwhelming stress. These are the causes. So now we're coming down to breathing. Obstructive sleep apnea is a very bad thing. In adults, it can lead to bedwetting. And how does it do it? It results to decreased oxygen. If there's decreased oxygen, the brain cannot function well, so the brain cannot produce antidiuretic hormone, which will now still lead to enuresis. Coming down to the body, diabetes results in increased blood sugar. So this blood sugar is pooled. Blood sugar, when it enters the kidney, it pulls loss of water, so it will now result in production of excessive urine, which will result in bedwetting. Then the next one is drugs. If you're having cardiovascular disease or that will make you take excessive diuretics, all these things can still result in your bedwetting. Then coming to the back, if you are having any neurological problem, it can lead to neurogenic bladder. There will be disconnect between the spinal reflex, the cerebral reflex, and the control of maturation. So so if you're having, maybe if you've had pelvic fracture, or you are having a pelvic cancer, or you've had a treatment of the pelvic cancer like pelvic radiation, all these things can damage the sacral reflex that controls maturation, thereby leading to your urinating. Then if you are coming to the bladder directly, like for example, if you are having urinary tract infection like cystitis, it can irritate the bladder, leading to excessive detrusor muscle action. The detrusor muscle is the muscle that compresses the bladder, leading to urination. It's still the same muscle that compresses the bladder, leading to urination. So the bladder, in the bladder you still have, if you're having prostate, like in elderly men, the prostate can grow so big that you be compressing the bladder, thereby making the bladder have little volume to accommodate an excess urine. So this can result in your urinating in the night. So any little amount of urine that enters the bladder will want to avoid it. Obesity does the same thing too. Obesity reduces the bladder volume, so you can do the same thing as the prostate too. Then the next one is if you are having an issue like in women, uterovaginal prolapse. Uterovaginal prolapse can also compress the bladder, thereby reducing the volume. Then the next one we are looking at in the bladder is if you are having what we call overactive bladder. Overactive bladder. It's common in females actually. The bladder becomes so overactive that any little amount of urine that enters, the two muscles become so active, so overactive, hyperactive that it will start contracting immediately and leading to urine. You're urinating. So then there are so many other causes, but let me just limit it at this. Now going to management. Well, the management for adult urine starts with counseling, motivational therapy. The next one is alarm treatment, alarm therapy. So you set alarm for the person, so the person can wake up from time to time to go and urinate. Then the next one is if these ones fail, most times they don't fail, but if it fails, we now go into pharmacological therapy like drugs. So in drugs, I won't be listing the drugs here, but I brought some of them up here. But in the classes of drugs we can use anticholinergics like tolterodone and oxybutynin. Then if that one fails, we can go into this antidiuretic hormone substitute like called desmopressin. So we can still use it just to do the same function of antidiuretic hormone. Then the next one we can still use. I hope you will never bully a bedwetter again. Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, Treaton, the Lupus Day.